Well, thank you for being part of my Facebook page and thank you for watching my videos. I really appreciate watching these educative videos because we will be discussing about a lot of things. It might not work for you, it will be helpful for you because you will be able to pass on the information to another person who might need your help. So, without wasting much of your time, today we are going to discuss about afterbirth pains. So why am I bringing this topic up? I thought of sharing with you the little information that I have because I have heard and noticed a lot of women have got misconception and have got wrong perception about these pains. More so for those who had a difficult delivery and those who underwent cesarean section, they tend to link the two delivery with the afterbirth pains to say it's because of the kind of delivery that I had. So I'm here to tell you that it's a normal process that a body undergoes after you deliver. The pain might vary from person to person, and some may experience it, some might not even experience it. So it doesn't mean if you are experiencing the afterbirth pains, there is something wrong with you. It's just a normal process, and there are a lot of factors that come in play. So to elaborate more about the afterbirth pains, they feel like period-like pains. Sometimes they feel like a less strong contraction pain. Why now am I feeling these pains even after I have delivered? So you are feeling this type of pains because your uterus is shrinking to go back to its pre-pregnant size. Before a woman gets pregnant, their uterus is that small. So imagine it from being that small to accommodating a large size body of the baby. So which means it will bulge to accommodate the baby in it. After you deliver, baby comes out, the uterus will not shrink back to that one. It will be that size at least. So from that size, the uterus is supposed to shrink further for it to go back to its pregnant stage, which is that size. So this process is called involution. So what is involution? It is the process of the uterus to shrink back to its pre-pregnant size. I've seen a lot of women experience this pain when they are breastfeeding babies, and they tend to shun away from feeding their babies because of the pain that they're imagining they will feel. So what usually happens when you're breastfeeding your baby, there is an hormone that is called oxytocin that comes in play. When you are breastfeeding the baby, that sucking reflex stimulates the production or release of the hormone called oxytocin. Oxytocin, among other functions that it does, one of which is to aid in evolution. So once baby is sucking, hormone oxytocin is being produced, the uterus will shrink. So I would encourage and urge you to continue breastfeeding your baby if at all you can manage to undergo or withstand that pain. Reason being, it is one of the things that will speed up the process of evolution because your uterus will shrink at a faster pace. This does not affect those women who are not breastfeeding their babies. So do not feel or think like if you're not breastfeeding your baby, your uterus will not shrink. There will be something that will go wrong in your next pregnancy. This will happen. We are not saying that. The body has got its own mechanism that it does. The body has got that capability of releasing the hormones that are needed for whatever process and function that the body is undergoing. The only difference here is with the sucking reflex of the baby on your breast will stimulate the oxytocin production, which will be on a higher level considering or comparing to the one who is just producing oxytocin in the natural way. So whether you're breastfeeding, you're not breastfeeding, it doesn't really affect the process of evolution. It will go back to its pre-pregnancy size. So if you intend to breastfeed your baby, breastfeed your baby. If you did not intend to breastfeed your baby, do not breastfeed your baby. I just brought it in so that I can explain why you feel a lot of pain while you are feeding baby. It's just because the hormone is being produced at a higher rate. So for how long are you going to feel this pain? Before I go to how long, I would like to tell you that the process of evolution takes 6 weeks for it to complete. For some women, it might even take longer than that. It might take less time like that, but on average, it's 6 weeks. It doesn't mean that you will be feeling those pains for the whole 6 weeks. The afterbirth pains, you will be just feeling them for a few days up to a week, or days further, depending on how you how you respond to your period pains, and the level of pain, the threshold of your pain. Having discussed that, how do one manage these pains? So you can only take over-the-counter medication, painkillers such as ibuprofen, paracetamol, which are also safe to take even when you are breastfeeding. Do sitz baths, take a warm or cold compress. To conclude our discussion, be aware of other differential diagnosis that can be made after delivery. It does not mean whatever pain that you experience after you deliver is definitely after birth pain. Sometimes it might be a UTI, sometimes it could be an infection to the uterus, sometimes it could be the obvious that you were thinking maybe your mind. And to be more sure, seek medical advice, talk to your doctor, talk to your midwife. They will be able to advise you accordingly. So thank you so much for joining me. Thank you so much for watch my videos. I really appreciate. My name is Alice.